Good day, dear friends, with you, Natalia, on the Doctor Online channel. Today we will talk with you about such a serious disease as rheumatoid arthritis. The relevance of this topic is related to the increase in the number of patients suffering from this disease. Speaking of this disease, I have two pieces of news for you, good and bad. I'll start with the bad one. This disease is chronic and incurable at the current stage of medicine. It leads to high disability, according to some data, up to 70%. Moreover, this disability occurs at an early young age, when our patients are still able to work. The good news is that if this disease is diagnosed as early as possible and adequate basic therapy is prescribed, a tragic outcome can be avoided, or at least a stable and long-term remission of rheumatoid arthritis can be achieved. If you watch this video to the end, I'm sure you will be able to identify the symptoms of this disease, how it manifests itself, and how serious complications it can lead to as a result of its development. So let's tackle this complex and widespread disease so that our joints don't become a luxury but a means of movement. Unfortunately, women suffer from rheumatoid arthritis 3 times more often than men, and the most common onset of the disease occurs at the age of 40 to 50. It is during this period that women undergo hormonal changes in the body before menopause. 4 stages are distinguished by clinical manifestations in the development of rheumatoid arthritis. The first stage is very early, lasting up to 6 months. The second stage is early clinical, lasting from 6 months to a year. The third stage is the expanded clinical stage, which lasts more than a year. And the fourth final stage is the late clinical stage, lasting more than 2 years. So, if we manage to detect this disease at a very early stage of development, then in this situation we can achieve good positive effects of treatment. It is assumed that this disease develops as a result of the action of various infectious factors, which causes a breakdown in immunity at the genetic level. In my practical work, I have observed more than a dozen patients suffering from this pathology, and I noticed such a regularity that if in youth a patient was diagnosed with reactive arthritis and a connection with the development of chlamydial infection was established, then after years there is a transition of this type of arthritis to rheumatoid arthritis, usually in 1/3 of cases. In addition, a certain role in the development of the disease is attributed to aggressive factors from the external environment, such as radiation bursts. The use of pesticides and herbicides in agriculture, as well as the use of dyes, preservatives in the food industry, including the infamous palm oil. A certain role in the development of the disease is attributed to the hereditary factor. Usually, in the family of the person suffering from rheumatoid arthritis, someone along the maternal or paternal line had suffered from this ailment before. As a rule, the disease develops slowly over several months or even years when clinically significant symptoms of the process appear. About 2/3 of rheumatoid arthritis cases begin with polyarthritis, when many joints are affected at once. Less often, the process involves one or several joints. Joint syndrome, as a rule, is leading in the clinic of this disease. The pain in this case is nagging and has a burning character, and it occurs in the second half of the night, closer to morning. Patients try to nestle in bed and take that position in which the intensity of pain will be minimal. The pain is accompanied by stiffness or so-called tightness, which lasts more than 30 minutes, and in some cases is observed throughout the day, only subsiding in the evening. Several clinical variants are distinguished in the development of the disease. The most common is the classic variant of rheumatoid arthritis. This process usually starts with the small joints of the hands and feet, and it is typically characterized by a slow, drawn-out course. The second variant is one in which, as a rule, one or several joints are involved in the process. Most often, the disease begins with pain and stiffness in the knee joints. The third variant of rheumatoid arthritis development resembles a septic process in its course and begins with a high fever, which is usually accompanied by chills. In addition, there is a decrease in body weight and a pronounced manifestation of intoxication, lack of appetite, headache. In this form of disease development, the patient's vital organs suffer. As a rule, this form leads to the development of disability. Joint syndrome in this case recedes into the background. The fourth form of rheumatoid arthritis development is characterized by the presence of polyarthritis joint syndrome with an increase in the spleen. At the same time, a significant decrease in leukocytes in the general blood analysis is observed. There is also a form of disease development, so-called juvenile rheumatoid arthritis, which occurs in individuals younger than 16 and has its own characteristic features. In addition to joint damage, vitally important organs such as the heart, lungs, liver, gastrointestinal tract, kidneys, vision organ, and skin are also involved in the pathological process. In the area of joints with rheumatoid arthritis, so-called rheumatoid nodules can be observed, which are dense formations the size of a pea rolling under the skin. So, if you suspect the above symptoms in yourself or your relatives, you should seek help from a specialist as soon as possible. This disease is dealt with by a rheumatologist. If for some reason a consultation with a rheumatologist is not available to you, independently submit the following tests, such as a complete blood count, urinalysis, biochemical blood test, including C-reactive protein, rheumatoid factor, anti-cyclic citrullinated peptide alanine, aminotransferase, aspartate aminotransferase, creatinine, total protein. I'll let you in on a little secret. If in a complete blood count, you see that your hemoglobin, erythrocytes are reduced, platelets and erythrocyte sedimentation rate are increased, and in a biochemical blood test, C-reactive protein is increased. If high titers of rheumatoid factor and anti-streptolizin O are observed, then with a high degree of probability, the presence of rheumatoid arthritis can be suspected. The next step in diagnosing the disease is to perform X-rays of the joints. It is mandatory to take images of the joints in both direct and lateral projections from both sides. This is significant for a rheumatologist. At the initial stage of the disease development, one can see epiphyseal osteoporosis and narrowing of the joint space. Later on, cystic enlightenments appear and the erosive process begins. In addition, there may be noted protrusions and subluxations of the joints, which ultimately leads to the formation of so-called walrus cyst. Patient cards suffering from rheumatoid arthritis. Different treatment schemes for the disease include the prescription of non-steroidal anti-inflammatory drugs. The most important role in the treatment of diseases is played by basic therapy drugs. In addition, hormonal drugs are used at a high degree of disease activity, and finally, biologically active drugs. Such methods as physiotherapy play a major role in the treatment of the disease. Most often, we use phonophoresis with 1% hydrocortisone ointment on the wrists for this. In addition, we successfully use a magnetic field, as well as various types and methods of joint massage and the use of therapeutic exercise methods. Some patients benefit from sanatorium resort treatment with the use of radon and sulfuric baths. In my practical work, I have observed more than 100 patients suffering from rheumatoid arthritis. Their illnesses progressed in the most varied scenarios. 20 years ago, a 37-year-old woman turned to me, a doctor by profession. And as we all know, doctors themselves do not like to be treated. They just can't imagine themselves in the role of a patient. This woman came to me with complaints of pain and swelling in the area of the right knee joint. After some time, the second knee joint became ill. In the future, the disease spread to the wrists and feet, which swelled and were painful to palpate. Over time, the range of motion in the joints was significantly limited. Almost immediately, I diagnosed the patient with rheumatoid arthritis and developed a full detailed treatment plan for this disease. However, my patient did not start taking the important drugs for basic therapy. And it played a cruel joke. She just hoped that the disease would go away on its own, but unfortunately, that did not happen. 5 years after the onset of the disease, the patient came to me with pains in the right hip joint. Upon conducting an X-ray, it became clear that the joint was practically completely destroyed. The question arose about the need for prosthetics of this joint, which was subsequently done. Also from my practice, I want to tell about a case with a more optimistic ending. One day a young girl, 17 years old, came to me, who had already been diagnosed with rheumatoid arthritis. The patient was interested in the question, could she get pregnant and successfully give birth to a healthy child, having this terrible disease and receiving basic therapy? I said, let's try. I prescribed her a full course of treatment, discussing all the minor details, which the patient followed without fail. The girl was an optimist in life and strictly followed all the recommendations I gave her. Despite this, we managed to achieve good results from the treatment. A year after the therapy, all the patient's indicators normalized. Her pain and stiffness in the joints decreased, and she returned to her active life, was able to get pregnant and give birth to a healthy baby. With these examples, I wanted to show you how important it is to be an optimist in life, to follow all the doctor's recommendations he gives, and to seek help from a rheumatologist as early as possible from the onset of the disease. So, in this video, we talked with you about what rheumatoid arthritis is, what symptoms of this disease we noticed, which specialist you need to turn to for help when identifying characteristic symptoms, and also determine the ways to treat this stubborn ailment. This was Natalia on the Doctor Online channel. Thank you for watching this video to the end. Leave your questions in the comments. I'll be glad to help you. Subscribe if you want, and stay healthy. Created the subtitles.